Today I'm going to talk about brain plasticity. I'll talk about theory as well as hopefully demonstrate the concept themselves using my own hand. In the past, researchers and clinicians thought of the brain as unchanging. Well, they were wrong. The brain changes, and quite dramatically. This is evident in a cerebrovascular accident patient entering the hospital with a significant language impairment and, at least in some cases, leaving after a significant improvement in his condition. Important brain areas in which the experience affects the brain are the primary motor cortex and the sensory cortex, which can be evident in these illustrations from neuroanatomy for clinical cases by Dr. Hal Blumenfeld. The primary motor cortex is the strip here, located anterior to the central sulcus in the frontal lobes. The primary sensory cortex is located next to the primary motor cortex, posterior to the central sulcus in the parietal lobes. Both are topographically organized, which means that if I were to place an electrode and stimulate the primary motor cortex, I would see movements in the body, for example, the hand. And if I were to stimulate the primary sensory cortex, I would feel sensation identical to those emanating from the body itself. The homunculus, little man that we see in this illustration, specifies these bodily representations. An interesting demonstration of the plasticity of these brain areas can be evident in a study by Bangert and Schlaug from 2006. These researchers reported that piano players showed the omega sign, indicating a larger hand motor area on both hemispheres, whereas violin players showed the omega sign on only the right hemisphere, the one that controls the left hand. So we can see that practice makes perfect, or at least leads to a significant brain changes. But what happens from lack of practice, lack of movement in the limbs? 4 weeks ago I broke my hand, more specifically the bone here, I believe it's called the ossa metacarpi, and as you can see the cast significantly restricts the movement of the fingers, these two fingers. And one thing that I noticed is that after a few days the sensation from the two fingers changed. It is somewhat hard to describe the change itself, but it feels like the two fingers have merged into one big finger which is bent like this. So a change in the primary sensory cortex was evident and is most likely in this case. But what I'm looking forward is testing the motor and sensory functioning of the hand after removing the cast, which will happen now. So I'm going to go out, I will remove the cast, and hopefully demonstrate these changes in the hand itself. Okay, I'm back, the cast is off. Well, the first thing I can see is some atrophy in the muscles themselves. It can be evident in these two fingers when compared to the other two fingers that were not in the cast. However, despite the atrophy, when I move the two fingers together, I can move at least partially to make a fist. However, if I try to move the fingers separately, and I'm trying to move this one, it can be quite evident that the other finger moves with it. And it's very different from these fingers, which cannot do it perfectly, but can still move them. I can still move them separately. Here, by the way, this finger can do it a bit better, but still I can see the right finger moving along with it. With regard to sensation, I can tell you that I've tried it earlier before entering the class. Stroking one finger while my eyes are closed gives the impression that I'm stroking one big finger or stroking both of them together, and it quite disappears when I'm looking at the fingers with both eyes open, and it's probably because of feedback loops that are involved. This is a topic I will not elaborate in this demonstration. Overall, I think this is a quite nice demonstration of brain plasticity, both of motor, mainly motor, but also sensory functioning. And hopefully for me, this will be the last demonstration, hopefully the last cast for me. So thank you very much, and I hope you enjoyed this video clip.